So I'm gonna go over the muscles and some stuff, and then I'm gonna go over the guts, but I can do it twice. So if you guys, you know, if somebody from the behind doesn't like, you don't feel like you could see enough, then I'll do it again, okay? So, all right, so we're gonna start with the ventral side of the cat, and oh, sorry, little guy. Bunny, sorry. All his little shit's coming out. All right. I have a male rabbit, by the way. If anybody has a female in this lab, please tell me. Okay, good, because we didn't have any in the other lab. All right, so starting up at the top of the rabbit's face, what I wanted to point out was, first of all, there's this huge cheek muscle. Okay, so this cheek muscle is called the masseter muscle. And what I want you guys to do is when you're digging through your rabbit, I want you to peel the skin up toward the ear, and then also like kind of dissect away some of the connective tissue surrounding the masseter muscle. And what you're gonna find is that there's this grayish, brownish, chunky stuff that's in part of the connective tissue up by the ear and around the masseter muscle. And then if you kind of dig on the ventral side of the masseter muscle, you're going to dig up these big loby grayish brown things, okay? These are salivary glands. So all of these tissues here, these grayish brown chunky tissues, are salivary glands. The ones that are on the posterior lateral side of the masseter muscle, that's a big gland known as the parotid salivary gland. And then the ones that are on the ventral side of the masseter muscle, more near these facial veins right here, are called the sublingual glands. Now, normally on a cat, and I can see, sorry, no, normally on a cat, like on a cat, you can see a physical duct that draws saliva from the parotid salivary gland across the masseter muscle into the mouth. And indeed, you can see that here. It's more of a thick band in the cat, but this strip, can you guys see that like little line right here? It's like a clearish line right there. That's the salivary duct called Stenson's duct, okay? And that carries fluid from the parotid salivary gland into the mouth. Okay, so once you have those parotid and sublingual glands exposed around your masseter muscles, then I want you to look at underneath the chin. So underneath the chin, if you kind of press down hard, you can feel the edges of the mandible bones. And there are two big strips of muscle that line the insides of those mandible bones. And those two strips are called the digastric muscles. Okay, so there's two of them, and they're lining the mouth, which has to do with eating, so digastric. And then you'll see there's a sheet of muscle that runs between those two digastric muscles. This is the mylohyoid, okay? So now we're gonna travel toward the sternum of this bunny, okay? And what I see is at the sternum here, let me just stab this so it stays together. Okay. So if we see here on the neck, I have these two muscle strips right here that are originating on the sternum and going up toward the masseter muscles in a V. Okay, so these strips right here, and they may be disrupted by the incision made for injecting the latex. Okay, so these muscles that go from the sternum to the masseter muscles in a V are called the sternomastoid muscles. Okay, so that's pretty easy to remember. Now, there's a sheet of muscle in between here that goes from the sternum all the way, it looks like, up to the mylohyoid, and it covers like where the trachea and esophagus are. If you press down on this area here, you're going to feel a hard bone right here. That's the hyoid bone, okay? Because of its amphistylic jaw connection, this hyoid bone is floating. So there's no connection to the jaw or to the skull. This hyoid bone determines the end point of a muscle that goes from the sternum to the hyoid, and a separate muscle that runs from the hyoid to the lower jaw. Okay, and I couldn't remember what that second muscle was, so we're not going to do it because I didn't remember what it was. But this muscle from the sternum to the hyoid bone is called the sternohyoid. Okay, so you have your sternomastoid, sternohyoid. So now, let's look at our chest muscles. Now, if you take the bunny's arm, we're just going to look at one side first. If I take the bunny's arm and kind of straighten it out like this, what I see is that there are several groups of muscles, and you can kind of see the connective tissue partitions between the muscle groups. So there's one group that runs from the middle of the sternum out to the biceps brachii muscle, the biceps muscle. This is called the pecto antebrachialis, okay? Brachialis, okay? Then you can see this triangle here. That triangle is the pectoralis major. Then you see this nice large strip right here, pectoralis minor. And then this final strip right here called the xiphi humerales. Okay, so what happens is xiphi humerales attaches to the xiphoid process of the sternum all the way up to the humerus. Okay, if I pull on the xiphi humerales, the cat goes like this. Or the bunny, sorry, goes like this. If I pull on the pecto antebrachialis, okay, xiphi, pecto antebrachialis. Okay, now, as we travel further down our bunny, we notice that along the midline we have that linea alba, like we have in all of our other vertebrate examples. And we can see that there are two parallel strips of muscle running just lateral to the linea alba. These are the rectus abdominis muscles. Okay, so rectus abdominis, and then oblique to those are your oblique muscles, your abdominal oblique muscles. What you're going to do to look at the three different layers of your abdominal oblique muscles is to make a little window. So you get to use a scalpel today. Yay. All right, so you want to make a little window, and what you'll find is that this outer layer here, the muscle fibers are running horizontally. This is the external oblique. Now if I lift up my little window and look just underneath, I see a group of fibers that's running vertically. These are the internal oblique muscles. And once I've carefully picked through those, I get to another layer where the fibers are running at a little bit of an angle. These are called the transversus abdominis. Okay, so your oblique muscles have three layers: external, internal, and transversus abdominis. So moving toward the thigh muscles, we have several muscles that sound familiar. So first of all, there's this big sheet here on the upper portion of the leg. That's your sartorius. Then the bottom sheet is the gracilis major. And then again, we have this little gracilis minor at the hamstring area of the bunny. If we look just deep to our gracilis major, we see a triangular muscle here. This is the adductor magnus, and just anterior to that is this strip muscle, the adductor longus. Okay, so sartorius, gracilis major, gracilis minor, adductor magnus, adductor longus. Okay. Also, on the leg, we have our big calf muscle, gastrocnemius. Deep to that, we have our tibialis posterior, and then the anterior portion of the shin is covered by the tibialis anterior. Okay, so I don't care if you put anticus. I don't understand why it's a different name in every single freaking thing. Okay, so the tendon that's holding the gastrocnemius muscle to the heel is this big white tendon here. This is called the Achilles tendon. Okay? So, now let's look at the muscles on the back. Okay, this is where I had trouble identifying muscles, so we only went with the few that I could find. Okay, so again, the first thing you want to do is kind of stretch out the forearm of the bunny. And what you're going to find is that there's a big sheet of muscle extending from the nape of the neck all the way to the shoulder. So this is your most anterior deltoid muscle. This is called the clavodeltoid. I think in your book it's called the clavobrachialis, but since we have a group of three, well, I could only identify two. A group of two deltoid muscles to learn, you can use either deltoid or brachialis. It's just, for me, it's easier to remember deltoid. Okay, so the nape of the neck to the shoulder is the clavodeltoid. And then if we move back and you kind of press down on the cat's shoulder, you're going to feel the spine of the scapula or the shoulder blade. Okay? And on top of that shoulder blade, the sheet of muscle is called the spinodeltoid. Okay? So we have our clavodeltoid, spinodeltoid, and then further posterior, this big thin sheet of muscle here, that's called the latissimus dorsi. Now deep to that and underneath the fascia that's up here in the lumbar area is going to be your longissimus dorsi. We didn't reveal that in the last class, but we did take up this huge thick fascia back here. So it's like super thick, right? So if you cut up underneath that, you're going to see this long muscle here, and then two shorter fibers that are more medial than these muscles. So first of all, this fascia is called the thoracolumbar fascia because it goes from the thorax to the lumbar region. And once we pick it up, we see these big sheet muscles right here, known as the erector spinae muscles. And then these more medial strips here are known as the multifidus muscles. Okay, moving back to the butt. All right, so the butt's a little bit difficult to see. You kind of have to get in underneath some of this connective tissue, but what you're going to find is that there's a small wedge-shaped triangle muscle that's over this huge roundish muscle here. So this wedge-shaped muscle is the gluteus maximus. Okay, it's called the maximus because it sits on top of this other gluteus muscle, which is the gluteus medius. Okay, posterior to that gluteus group is this huge sheet of muscle called the vastus lateralis. Okay, it's large and it's lateral, vastus lateralis. Anterior to the vastus lateralis on the leg, you're going to find a muscle and a really shiny tendon. Let's see. It looks like she cut it on both sides, but you can see the remnants of that tendon. It covers the area between the vastus and this anterior leg muscle right here. So this muscle if you can kind of look at the fascia right here, the muscle fibers kind of grow into that fascia. This fascia is called the fascia latae. And the muscle that has its fibers within that fascia, its job is to hold that fascia tense. So it's contracting all the time to keep tension on that tendon in order to keep the leg in proper tone. Okay, that muscle is called the tensor fascia latae. Okay, so it's inserting into the fascia latae and it's keeping that fascia latae tense. Okay, so you have vastus lateralis, you have tensor fascia latae pulling on the fascia latae, you have your, I can't get through to it on this side, but you have your gluteus maximus, gluteus medius. Okay, now let's travel back up to our shoulder here. And I want you guys to see that what Tori did here was she cut through my spinodeltoid muscles, and I'm sure the acromiodeltoids were under here, but since we can only see parts of each, we're doing clavo and spino. Thank you. Okay, so what she's done is she's cut through the clavodeltoid here, cut through the spinodeltoid here, and then kind of cut through this big latissimus dorsi. So what I want you guys to appreciate, here's your big shoulder blade. And if I lift up the spinodeltoid here and some of the trapezius muscles that I can't identify, what we'll notice is that in the middle of this shoulder blade, you can feel the spine of the scapula. So there's a group of muscles that sits atop or dorsal to the spine of the scapula. There's a group of muscles that sits below or ventral to the spine of the scapula. And then there's a little wedge-shaped muscle in the posterior corner. The top group is called the supraspinatus. Okay, it's over, it's super to the spine. The bottom is called the infraspinatus, underneath. And this little wedge is called the teres major. Okay, I don't know what that means. All right. Now, if you flip the shoulder over and look underneath, there's muscle on the underside of the scapula as well. This muscle is called the subscapularis. Huh? Pretty easy. Okay, and if you look, the shoulder blade is attached to the rest of the body by these thin muscle fibers here. Okay, these muscle groups that are attaching the scapula to the spine are called the rhomboideus muscles. Okay, there's one rogue rhomboideus muscle that extends from the rhomboid group all the way underneath the clavodeltoid up to the head or the cap. Okay, so you wear a cap on your head. This is called the rhomboideus capitis muscle. Okay, so look, yes it is. Okay, so rhomboideus capitis, subscapularis, supraspinatus, infraspinatus, teres major. Okay, let's look further back, posterior. All right, I have my latissimus dorsi here, and I'm going to peel it up and bring it over toward this way, and I'm going to take my shoulder blade and kind of stretch it out. Okay, look at these groups of muscles that have like these ragged, serrated edges here. Okay, there's a group that's connecting the shoulder blade to the oblique part of the lateral part of the bunny, and then there are other muscles coming up from the ventral area, and they're kind of interlocking with those dorsal flowing muscles. Okay, so these ones coming from the shoulder blade are called the serratus dorsalis, serratus like serrated edges, and the ones coming from the ventral region are the serratus ventralis. Okay, so they kind of look like this You can kind of see they interlock together. Okay. If we look underneath our serratus dorsalis muscles, we see ribs here. You can see evidence of ribs. And the muscles in between those ribs are known as the intercostal muscles. And one thing I forgot was that if we look underneath the rhomboideus muscles here that are extending toward the neck region, you're going to find that there's a huge muscle covering the neck. So like my dogs, their favorite thing to do is eat turkey necks, and it's really disgusting. But the big sheet of muscle that's covering the entirety of that neck is known as the splenius. I don't know where that came from. Sorry. It has nothing to do with the spleen. It's not even spelled the same, so let's not worry about that. Okay, so now what you want to do is you want to cut into your bunny. And so you can follow up through that linea alba. Once you get to the thoracic area, you're going to have to break some ribs, okay? So bend the ribs back. And in order to cut thoroughly and expose the internal organs, you're going to run into this big sheet of muscle up here, okay? This is the horizontal septum in the mammal. It's the diaphragm. Okay, so it's splitting the abdominal from the thoracic cavities. If you cut down the sides of the diaphragm, it'll just form, one of your little layers here so that you know where it is. Okay, so in the thoracic cavity, I can see the lungs and the heart. And the heart is still encased in its pericardium. And if I lift up on the pericardium or the heart and then I pull down on the diaphragm, I notice that the mesentery continues and attaches the heart to the diaphragm. That's called the mediastinum, okay? And what that mesentery is doing is it's splitting the left and right halves of the thoracic cavity. Okay, so we have the horizontal septum, which is the diaphragm, and the vertical septum, which is the mediastinum. Anterior to that, you want to pick away through your sternohyoid muscles so that you can reveal the tubes underneath. Okay, so I have two tubes right here. What do you think this one? Esophagus.
Yeah, the other one.
Close. And then this one, of course, is
Trachea.
yes. So you were right. Okay, so we have the trachea and the esophagus, and we can tell because the trachea has these cartilage rings, right? Okay, so now what we're going to do is travel to the abdominal cavity. And the first thing I want to do is lift up on the diaphragm and pull down on the liver. And I notice this mesentery, and it's connecting the liver to the ventral body wall. What is that ligament or mesentery? Starts with an F. Falciform ligament, okay? Your liver, look at how big this liver is. It's enormous. Okay. If I lift up on the bulk of the liver, I reveal the stomach, and I reveal another mesentery that has a little accessory lobe of the liver sitting in it. That mesentery is extending from the liver to the stomach. It's called the gastrohepatic ligament. If I look up on the liver here, I see a stinky green balloon. Gallbladder. Okay, good. Now, I ruined all of these lovely ducts here. So what you can do is, and maybe I'll try later, or maybe we'll just leave it off the exam, but if you find the duodenum and you follow the connection between the duodenum and the liver, you can find the bile ducts, okay? So there are two bile ducts. Well, there are three, and they're shaped like a Y, and they dump their contents into the duodenum, first part of the small intestine, okay? So up here, the big scissors is my stinky green balloon, all right? So this is the gallbladder. If from the gallbladder, there's a duct that travels from the gallbladder to this duct here. So this is called the cystic duct. From the liver is another duct called the hepatic duct. The two of them join together at the base ducts coming from the liver. They join together to form the common bile duct before they dump into the duodenum. Okay. Look at this big stomach. Like, I've never cut into a vegetarian animal before, like you know, one of these, like a rabbit, I guess. But if you look at the stomach is this huge pouch, and this poor bunny ate so well before he gave himself to science. And if you look, there is a mesentery that is coming off the greater curvature of the stomach. This is the greater omentum, okay? Usually the greater omentum covers the entirety of it's disgusting. It's like a huge bag. It covers the entire intestinal cavity, but I think when we cut it open, it kind of lost its integrity. On humans and other omnivores, it's really fatty, okay? It's disgusting. All right, so look at this thing. It's on the stomach. Spleen. Spleen. Okay, that's close. Okay, so look I'm going to follow the stomach around and look. Pinch. Pyloric sphincter. Okay, so this must be the duodenum, right?
Yeah.
Okay, now I'm going to look in the mesentery here. Yes. Okay. Now, the pancreas isn't like an organ that we'd think it is. It's all this chunky stuff. Remember how the frog had that little strip of pancreas in the mesentery there? The same thing is true here. All of this brown chunky stuff here, that's all pancreas. Okay? Gross. Okay? Okay, so now we're going to follow the duodenum. It's like Dora's Big Adventure. Where are we going? The jejunal-ileum. Okay, so we keep following this mess. So when an animal is a vegetarian, you know, they have like fibers that are difficult to break down into nutrients. It's a very inefficient type of food source. And they need a ton of intestine in order to break it down and get nutrients. So that's why the intestines are so gigantic. Okay, so look here. I have all of this intestinal stuff. And if you notice, just like in the frog, all of the jejunum and ileum are joined together by the lesser omentum or mesentery proper. Okay, so can you see all of this mesentery here? And see the blood vessels? There are yellow and pink blood vessels. The yellow vessels are the intestinal veins, and they're draining nutrients that are absorbed in the small intestine into this big yellow vein. What do you think that is? Hepatic portal vein. Okay, but look, so in this lesser omentum, we see all of these vessels, right? And then look at this chunk in the middle of them. Those are lymph nodes. Okay, those lymph nodes are special, and they form a lymphatic organ known as the pancreas ocelli. Okay, so this is where all of those nutrients that are being absorbed and coursing through the intestinal veins get their primary filtration in this pancreas ocelli before being filtered for sure in the liver. Okay, so let's follow this bad boy around. Disgusting.
Agreed.
Yes. I don't know where one ends and one begins, but like I do know. Okay, so if you look, the color of your intestine will change. Okay, not necessarily the size, because it seems as if the small intestine is hypertrophied in some areas for this bacterial digestion process to happen. So, but shortly after you leave this pancreas ocelli area, you'll notice that the intestine changes color. And what you're going to see is that there's an area in this intestine that has a little bend in it. I wonder if that's the area I'm looking for. Okay, well, there's an area with a bend in it. Yeah, it looks like this area. Okay, and that little bend is the cecum. Okay, so the cecum helps, I think it holds, I'm not sure what it does, it's like our appendix, but it helps with lymphatic processes and digestion of, so I think it has like helpful bacteria, gut bacteria. Okay, so look, now, look at all the bullets in the chamber here. Yeah, okay, so this is the colon. Okay, we're not going to determine regionality of the colon because I don't even know. But the colon is being held to the dorsal body wall by the mesocolon. All right. And then if we travel down toward the posterior, we're going to find the bag here, urinary bladder. Okay. And if we move all the organs to one side, we can dig out a kidney from the back and observe here the ureter that's going toward our urinary bladder. There's one on both sides, 2 kidneys. I didn't dig this one out though. Huh? Nice. Okay. And this is a boy. All right. So look at his junk's on the outside. Okay, and they're contained within a sac called a testicle. Okay, so the testes are the actual organs inside the testicle. The testicle holds the ducts, the arteries, the veins, the nerves, and the testis itself. Okay, testis is singular, testes is plural. If you open up this testicle and kind of peel it back, you'll notice that the testis has certain parts to it. Okay, so this red part here is the testis itself, and then the apex of the testis is this white part here that's known as the epididymis. And then from the epididymis, you see there's a duct coming from it, and you can see, look, there's a pink and a blue too. That's the testicular artery in pink, testicular vein in blue. The duct is the vas deferens. Now, these testes are outside the body so that they're the optimal temperature to produce working sperm. All of these, the vas deferens, the artery and the vein, enter the body as a cord known as the spermatic cord, and they enter the body through an actual cavity in the abdominal area known as the inguinal canal. So if I kind of peel up on the urinary bladder here, I can see where the vas is entering the urethra underneath. So see, I can pull on the spermatic cord, and that's evidence that it's connected to the outside. Okay? So, go.